So another thing that a lot of us found hampering us in our first couple of months of residency was our inbox and what to do with the items that we get in it. So every morning or throughout the day, we have on our screen inbox and messages. So messages are messages from your staff, messages from other colleagues asking you questions or giving you updates either on OSCAR or on patients or maybe patients they'd seen the night before. With inbox, however, this is where we get all the lab results, all the discharge summaries, all of the comments on radiographs that we get from the community or from our own patients. Things that we're following up on, things that have been ordered by other physicians or our consultants. So just a quick way to look at inbox is we need to think of what we need to do with this information. Do we need to do anything with this information? Was it an FYI from a consultant saying they saw our patient, no further action is required? Or was it a discharge summary saying, hey, we saw your patient, they were in hospital, we made these changes to their medications, please follow up on these specific changes to see if they need to be further carried out or if you would like to put them back on their same medication regimen or what have you. So one of the things we also get is results from mammograms or FOBTs or pap smears. And so if we open up a test chart, here it's this person named CRC. If we have something in preventions, you will have another video which discusses vaccinations and immunizations. If we have an FOBT result and it was negative, we click on FOBT here, we say normal, and we click save. We can make comments as well if there was follow-up plans. If for whatever reason there was a pap smear that was done, and if it was abnormal, we'll click abnormal, we'll say the follow-up plan, whether it needs repeat in 6 months or whether it needs to be sent to COLPA. Another thing that we may need to do is when we get a discharge summary or if we get a note from a consultant saying that they've made changes in medications, and if we deem them still to be appropriate, what we would do is update their medication list on our chart. So it's important to do this periodically and as frequently as possible, just so we know what medications our patients are taking or if they're taking any over-the-counters. And so it's not under medications, which pulls up how our prescriptions, but it's under this tab, the green one. We click it, I apologize, we click the plus, and then here we can make a list of their meds, and it's important to date it as May 21st, 2015, etc., or whenever you make the change, so we know when the latest update to the medication list was done. And then at that point, you click this button here, or click this button here to save it, and it exits, and it's here. Another important part of OSCAR that we use when we do get results from our inbox is the tickler. And what the tickler is, it's a reminder for us to set up a future action. So if we get a lab, we pull it up, and it says repeat colposcopy in 5 years. Being residents in a program that's only a 2-year cycle, what we want to do is make sure that the future residents or our staff know to follow up on that in 5 years. And so what you would do is, on the computer screen on OSCAR, there's an orange tab on the left that says tickler. You click it, and you can see which ticklers are up on your patient and to see if they need follow-up on this year. Alternatively, you can click the plus sign and you can add a tickler message for yourself. So once you're at this page, you actually need to click the patient number and it opens up this box. So it has the date here, the patient name, and the message. This message, for instance, will be repeat colonoscopy in 5 years. See note in chart from May 2015. And then you click here, you have options 6 months, 1 year, or calendar lookup. Under calendar lookup, you go with these 2 arrows, 2016, 17, 18, 19, 20, and pick a random date, whatever is 5 years from now. That's set, submit and exit. Another important part of the inbox is if we get updates from our consultants saying they've seen our patients and no further action is due, or they say something like they've done their TB tests, no further TB tests should be ordered. And at that point, you can put yourself a reminder here, no further TB test in future. And again, you click this box down here. Under ongoing concerns, you can put things here like INR target for this patient is 3.5 for whatever reason. And you can put the reasoning there, save it. And it's always important to update the medical history and social history with visits, depending on if it's chronic conditions or chronic stressors that are important. Under social history, it might be important, and I find it important to list family members that are important to them in case we need to track down our patient for whatever reason.